time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, folks, we're continuing on the journey this year. As I said before on a number of shows, this year is a very, very critical year when it comes to the national elections. And we're trying to bring as much information to you as possible, factual information, so you could make a decision. Now, May 20th is a primary, and one of the primaries one of the areas is the 17th Congressional District, which is currently held by Congressman Cartwright. And one of the candidates on the Republican ticket is Dr. David Moylan. He's been on the show before. He is also the Schuylkill County coroner. And let me welcome you again to the show, Dave.
Sam, thank you. As always, it's a great pleasure being here.
It's a challenge, isn't it? You know, as you're going around, it's a challenge, and I'm trying to give everybody an opportunity to come on the show to explain different things so our viewer could get a well-rounded education as to who is doing what. And certainly we'll have other candidates on the show. But one of the things that we talked about some shows, Doctor, is that a plan. People who have, a plan to bring to Washington, all right? And today, I understand you have some slides, and you'll fully explain some of those slides as to what the purpose is, correct?
Yes, and Sam, I really value your show in that one has an opportunity to bring facts, not just some sound bites.
Well, that's what I'm hoping. I'm hoping that, you've been on a number of times. Of course, you're also a coroner, so we have to discuss what's happening. But this is a political show, though. We want people to understand who you are. When I bring Representative Cartwright on or whatever other people on, let the people decide. What primarily are we going to be talking about today?
Well, I would like to address our attention to the Patient Protection and Affordable Care Act. Now, you notice I didn't call that Obamacare, because it's my understanding that the president actually thinks it's a pejorative with almost racial overtones if you call it Obamacare. So I'm going to give him his due, and we'll call it by its formal name, Patient Protection and Affordable Care Act. But what I want to show, I think, is that it's not going to protect patients, and it surely isn't affordable.
Now, you are a doctor.
I'm a physician. Yes.
Every day you're out there saving people's lives.
Well, I try to. I'm working in a very challenging field, that is oncology, in particular radiation oncology. And yes, every day is a struggle to try to beat this disease down. But fortunately now in this country, we have the technology, beautiful drugs that have turned the field around in the last 5 years. Technology like the cyber knife, which we've talked about. And my fear is that if we march down the lane of the Affordable Care Act, we're not going to have this technology.
Now, Dave, you have been, very successful at Simon Kramer. You have a great career. Before we get into the slides, why did Dr. Dave Moylan, who you successfully ran for coroner, and so far from what we see, you're doing a fabulous job as a coroner and your people, why is it that you decided that you should take this on to run against Cartwright, or to run for the 17th Congressional District?
Well, the 17th, as is now constituted, was represented by Tim Holden from St. Clair. And although I didn't agree with everything Tim supported, one of the things that I found him to be very reliable for was the sanctity of human life. And there were, as you can see on the screen, 2 votes in the 113th Congress that affected human life. And one is Obamacare, or the Affordable Care Act, and the abortion protection bill that was before Congress.
So what are we looking at right now? This is Cartwright's voting record, right? Okay, what does that mean?
As it applies to human life.
Now, he said to me on the show that he is pro-life.
I know he said that.
No, he didn't say it but he's told me in my office. Okay, so what is he saying? Is he contradicting himself here, or is this something that...
in May, he voted against the repeal of the Obamacare health care law, and that has major implications in the field of abortion. And then there was a bill before Congress called the Pain-Capable Unborn Child Protection Act, and it's estimated that would have saved about 15,000 unborn children. And he voted against that. It passed, fortunately, and it's now before the US Senate, where it'll probably have some difficulty getting through. But he voted against that. It would have saved 15,000 lives.
Next slide.
And the Affordable Care Act does raise major problems with regard to religious freedom. And one is the Health and Human Services mandate that insurance programs cover abortion, abortion-causing drugs or abortifacients, and contraception. And many faiths have difficulty with that. And you might know that there is a lawsuit against the Little Sisters of the Poor. Can you imagine that? These little nuns, because they don't want to provide this coverage in their insurance, the government's going against them. Now, hopefully the lawsuit's they'll prevail in the lawsuit, but if not, they will face onerous penalties of millions of dollars if they don't comply. That's not right, Sam.
Next slide.
And Max Baucus, he's the retiring senator from Montana, and he was one of the key architects of the Affordable Health Care Act. He has recently said that he sees a train wreck coming down the pike. That's a paraphrase, and I just thought this was illustrative. It's the wreck of the Red Arrow that occurred in 1947 outside of Altoona, Pennsylvania. But to call the Affordable Care Act a train wreck, that's not fair to train wrecks, really. And there's other natural disasters that the country has faced within the last few decades that have cost billions of dollars. And of course, Sandy last year cost the country $100 billion. Katrina was $81 billion. And the Northridge earthquake out in California was $42 billion. These huge figures pale to what the Affordable Care Act will cost over the next 10 years. In the next decade, it's estimated that it could be as high as $2.6 trillion. I believe Congressman Barletta used that figure on your show recently.
So what you're saying is that you're comparing these disasters. You're saying that the Obamacare, excuse me, is a major disaster to the point of $2.6 trillion in the
over
first
the next 10 years,
okay. Right.
compared with only $100 billion for Hurricane Sandy.
All right, so what you're doing right now, Dr. Moylan, is you're explaining some of the key issues of the Obamacare and what the cost is going to be. Now, we're going to go to break. We're going to come back and we're going to talk about furthering, the information that you're going to present. Because as we said when Congressman Barletta was on the show, and I just had Congressman Mike Kelly on the show, and I was very appreciative. He drove from Erie, Pennsylvania to come on the Sam to bring facts, presentation. And I think you're going to show there is a plan out there, okay, that's available. My question, or always my concern is why, if we see these happening and we're seeing millions of Americans now who are losing their insurance. There are some that are doing well with it, I'm going to say, but it's the minority. There's not a majority of people when they're signing on the website for insurances. So, and the fact is that we have to, sometimes people feel that the Republicans don't care about health, don't care about the pre-existing conditions, don't care about these different things that are so very important. And I think we'll find that not to be true. I'm talking to Dr. David Moylan, folks. He's running for Congress in the 17th Congressional District that currently is being held by Congressman Cartwright. And yes, I will have the invitation for Congressman Cartwright, who was on the show before, very gracious, and he'll be able to come on to explain what he is doing and what he has to say. We'll be back right after this. Welcome back to the Sam Lesante Show. Remember, 24/7, SSPTV.com. All of our shows, plus my email is sam@ssptv.com. And remember, folks, if you're watching us on Comcast, we're now on channel 190 with all our shows, and Monday through Friday from 7 p.m. to 11 p.m. on 190, and Saturdays and Sundays we're on from 10 a.m. to 11 p.m. Full days of all around the town. Sam Lesante shows, Body Beautiful, The Girls. They're all on channel 190, which you're watching right now on Comcast. Now, this is only Comcast in Pottsville area. And of course, just so you know, we are on 10 times a day with our local news for the Pottsville area on channel 15, Monday to Saturday. My guest today is Dr. Dave Moylan, who is running for Congress in the 17th Congressional District of Pennsylvania. And okay, so continuing on of what you want to do when if you should become congressman, you have some slides here and you're explaining them, okay?
Well,
so let's put that other slide up. Now, what's this? This is another train wreck.
Yeah, it's another train wreck. We're having some fun with the president.
Okay, so
but as you can see down here, Sam, this is the legislation. And I'm working my way through it. But, Sam, it's like reading the telephone book. I tell you, so much minutia
That's in front of him, folks. You can see right now. This is
and this isn't the whole version. This is the Cliff Notes version.
Now, I had the actual bill here when it passed. It was this high on my desk, okay?
About 2,600 pages.
Yeah. Now, you said there's some good things in this, right?
Yes, there's some requirements for continuing medical education and recertification among physicians. And certainly, I think that will help to cut down on malpractice. But I think any rational health care reform bill should include a provision for tort reform, maintaining the plaintiff's right for justice, but just coming off of some of these extraordinary awards. There was just within the last year an award in Norwalk, Connecticut for $58 million. And even if you were a professional athlete, you probably wouldn't earn that much money in your lifetime. Mm-hmm. So some of these are just out of hand. And yes, physicians do practice preventive medicine and protective medicine to try to cut down on their exposure to malpractice. And that will raise the cost of delivering care.
So we're going to continue on with the slides, and he'll explain to you just exactly now. Healthcare in Canada.
Well,
okay.
Yes. I think there's socialists in the government that think that the Affordable Care Act is just an intermediate step to a universal, single-payer, government-run care system. And we know how that's working out, Sam. And our neighbor to the north, Canada, that has been in effect since the late 1940s.
So what you're saying is, okay, and I haven't spoken to the Canadians, so I don't know how they're doing up there, but the first thing is the 9.5 weeks referral from the GP to the specialist for consultation.
Yes, that is you come in, see your GP, your family physician, and he or she determines that you need to see a specialist, maybe a heart problem, maybe a bone problem, whatever. It's 9.5 weeks just to get in and see the consultant. And then the consultant will schedule you for surgery, so the time from the actual referral to the definitive treatment can be close to 5 months.
19 weeks.
19 weeks, yes.
Then you have here plastic surgery.
Yeah,
procedure.
I think our friend Rob Kimmel would probably go out of business if he was up in Canada.
41.5 weeks almost.
For plastic surgery.
For plastic surgery. And then, of course, for...
Well, this is one that I know something about. Medical oncology. There's a type of lung cancer called small cell lung cancer, and it doubles in the number of cancer cells every 28 days. So in Canada, the time from the referral for the medical oncology to start treatment, 4.2 weeks. The cancer, if it was small cell, has doubled while you're waiting.
Now, are you saying this is where we're headed if we continue on with the Obamacare? Or what's the analogy here?
Well, you might think that you'd be able to work the bugs out, and maybe cut down on wait times. But there's an organization called the Fraser Institute, which is basically a watchdog organization, and they have monitored wait times in Canada for the last 20 years. And since they've been keeping track of this, it's gone up 104%. It hasn't improved. The wait times have lengthened over the last 20 years.
All right, so
by 104%.
So I don't want to mislead the viewers here. So again, am I getting the impression here, and please correct me, that if this Obamacare or the Affordable Care Act continues the way it's going, that we may be looking at the same thing that Canada's looking at?
Well, I have a feeling that the ACA is going to collapse under its own weight, and then there'll be a push to replace it with universal health care, more or less Hillary Care, which was repudiated in a bipartisan fashion in 1994.
All right, let's continue with the slides. We have some other information up here. Andy, if you want to put, okay. Now, this is a Chicago Tribune opinion.
Yeah, this was an op-ed piece that appeared in the Chicago Tribune, and this is President Obama's hometown newspaper.
Stop digging, start over. This political salvage mission by the White House is
basically they're saying you can't patch this up. Stop it and then start over. Okay. And that was their op-ed, and I think it's a word to the wise. And the president is often quoted as saying that the Republicans are not coming up with any alternatives.
Okay, so here are some of the goals of health care reform, okay?
Yes, and I think what happened was a bunch of bureaucrats got together, and everybody admits that the present health care delivery system is flawed. And they got together and they came up with this solution, the Affordable Care Act. But I think it's a case, Sam, of a misdiagnosis. And the prescription that was written is the wrong prescription, okay, in medical terms. So doctors were not brought into the mix to get their opinion on what should be done. So I think it's wise to get a fresh, clean piece of paper out and start over.
Continue on, Andy.
The Republicans have come up with some solutions or some proposals.
Now, this is what you're referring to right now,
yes,
right?
This is one, and this is called the Empowering Patients First Act, and it's H.R. Bill 2300. And it was put forward by Dr. Tom Price. Now, Tom Price is was an orthopedic surgeon until he went to represent Georgia's Congressional District. So again, there's medical input into this. But his proposal would call for tax incentives to incentivize people to get health coverage, and also to improve access to health savings accounts. And that's a mechanism that I think has great merit. And finally, he would propose
purchase of the insurance
yes,
plan.
allowing people to cross state lines when they're buying health insurance.
That's Congressman Barletta and Congressman Mike Kelly also stressed that they should be able to cross lines to get pricing, I guess.
Sam, there's three other proposals in Congress now. The Republicans have yet to coalesce behind any one, but I think that's what needs to be done.
Now we have physician shortage projections.
Well, yes. From 1987 to 2007, the population of the United States increased from about 242 million people to 302 million. That's about a 24% increase. The number of physicians has only increased 8% over that time period. So it's just logical we're not going to have enough physicians to do the job. So that's another problem that needs to be addressed. And these are projected figures. One's from the American Medical College Association. The other's from the American Academy of Family Practice, and then another Health Resources Association. And they're predicting up to 159,000, a shortfall, that many physicians by the year 2020, just when you and I are going to need them, right? And of primary care physicians, it could be 65,000. So we're in trouble. And there is a built-in bottleneck to the supply of physicians. The American medical schools are churning out about 26,000 physicians with four-year degrees per year. And there's slots for residents of only about that number, maybe a few thousand more. And yet there are many qualified physicians from other countries and that are just waiting to be able to admit to residency programs.
And you know, you just said something. He says, and that's when we're going to about need them. Well, yeah, the point is that there are people out there right now that what happens is that when they're looking for that primary care, that doctor that they had, and you're going to be told they can't see that doctor. You have to go to PA, or you have to do this, and etc. Then it becomes. I keep saying, you know, people who are for something. Everything sounds good, okay? When you listen to the president and he says you can keep your doctor, you can keep your same insurance, okay? And of course, as Congressman Barletta said, it was labeled as the big lie, okay? Which was unfortunate, okay? And but I mean, the intent was there, but now we're seeing some critical things happening, and I can't wait for Congressman Cartwright to explain to me why he's so supportive of this particular thing, because again, logic shows that this is going to implode.
Well, another frightening statistic, Sam. Every day, 10,000 Americans turn age 65. 10,000 a day.
Folks, I'm talking to Dr. Dave Moylan. He is the Schuylkill County coroner, and he is running for the Congressional District, 17th Congressional District. It's currently held now by Congressman Cartwright. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. My guest today is Dr. Dave Moylan, running for the for Congress in the 17th Congressional District in Pennsylvania. Now, you're showing some slides, and this is the Indian Healthcare Service. I find this interesting. The Indian Health Service model. What is this, Dave?
This is my own idea, Sam. It hasn't been completely vetted, but I think it's worthy of consideration. And basically, the Indian Health Service was formed in 1955. And it's now present in 35 states, and they have quite a few employees, including 500 pharmacists, 300 dentists, and 900 physicians, as well as 2,700 nurses to provide care to our Indian brethren. And they're actually taking care of 1.8 million Indians of a total population in the United States and Alaska of 3.3 million. Their budget is $4.3 billion. Now, I'm sure this is, and I'm sure the Indians would testify to this, it's not the greatest health care in the world, but it's something. So how could we take care of perhaps what's estimated to be 47 million uninsured Americans? And I think this might be a model that could be explored. And I've done some math here. If there's 47 million uninsured Americans, and we divide by the 1.8 million Indians that are under care, that gives us a factor of 26. Let's multiply 26 times the annual budget for Indian health services, 4.3 billion. It comes out to 111 billion, which is a heck of a lot smaller than, or it's comparable to Hurricane Sandy,
yeah,
but it's better than 2.63 trillion.
Is that the last of the slides?
I think there might be. Well, this is just where I'd like to kind of cap off. And you know,
this is you now. This is you.
Me, Sam. I'm an underdog, and I'm the first to admit it. I'm underfunded, but I came across this quotation by Mahatma Gandhi, who was the great pacifist from India, and he said, "First they ignore you, then they ridicule you, then they fight you or attack you, and then you win." So right now I'm being ignored, but hopefully over the next 8 months, we'll see a change.
I'm for definitely good debates, okay? And I've met Congressman Cartwright. He is a gentleman. He was gracious. I'm for good debates, okay? Not personal. But sometimes power is a terrible thing. And when sometimes people want power at any expense. Yeah. I'm hoping that this election will be a good election, that there'll be a lot of information given by the Republicans and by the Democrats, whoever, if it's going to be Cartwright. I'm hoping that they're going to be truthful. But what happens is people have their power, and he's my man. You hear he's got to get Irishmen, you got to get the Italian in, you got to get the Polish people in, and this is so much nonsense. I said once before on my show, don't vote for something because their name is a ski. One politician in Hazleton said, I was saying don't vote for the Polacks. That's not the case at all. I'm saying don't vote for Sam Lesante because he's Italian, or don't vote for Moylan because he's Irish. Vote for the person. We're in such a dismay in our country today, Dave, because people are going out saying, you got to give the guy from Stratton a vote. You got to give the guy from Schuylkill County a vote. Bull crap. Yeah. Vote for the person. Wouldn't you agree?
Sam, I met Congressman Cartwright at his town hall in Pottsville, and we spoke afterwards, and I have to say he's got a wonderful handshake and seemed like a great guy. But I hope we have a gentleman's agreement that we're going to stick to the issues, that we're going to have plenty to talk about.
When they go off the issues, you know you are a threat.
Yeah.
When they come after you personally because your hair is black, or you got a little weight on you, or your mic is wrong, or you're short, or whatever, then you know that you got them. And I hope that doesn't come to that. Folks, I'm talking to Dr. David Moylan. He's running for Congress in the 17th district in Pennsylvania. And yes, we will have, I'm extending an invitation to Congressman Cartwright to come on and to explain why he's voted. And I'm hoping that we get the best in there because we certainly deserve it. See you next time.